I would have assumed that they would be following CDC guidelines and they would stay masked up.
Step inside Awake Health, and you might think you've gone back in time, before the pandemic. You'll see the receptionist and another staff member who often don't wear masks. Same for the doctor when she appears at the counter.
She said she will not be wearing a mask, but we're free to wear ours or not wear ours.
Jeff and Shelley Gann's surprise turned to anger when, they say, the doctor spent their entire half-hour appointment raging about coronavirus restrictions.
So it was very shocking, her behavior.
You don't have to ask patients. You can hear those views right from the doctor's own unmasked mouth.
So to me, this is a scamdemic. It has little to do with public health at this point. It has more to do with exercising government control.
And you said scamdemic.
Yes, I did.
It's not a pandemic to you.
No.
Do you and your staff wear masks in this office?
Not anymore. I personally don't feel that masks are protecting or helping me in any way, shape, or form. In fact, they increase my anxiety. Laser hair removal, sweets.
It's not her unconventional views or blatant violation of the state mask mandate that sparked our investigation into Dr. Anna Elperin. Weeks before we sat down for this interview, we sent in undercover journalists to investigate a tip that Dr. Elperin was allegedly handing out COVID vaccine exemptions for a price.
So I made an appointment at Awake Health, and I said that I wanted to see Dr. Elperin to talk about a cosmetic procedure.
Our digital investigative reporter, Taylor MIRFENDERESKI, made an appointment. Health and beauty is one of Dr. Elperin's specialties.
And I walk into the office, and I'm greeted by a medical assistant who is in the room with me doing the typical things you would expect at a doctor's office, weighing me, taking my height, blood pressure. And then after she's done with those standard procedures, she says, "So are we just doing the COVID exemption today, or are you here to establish care?"
What did you think of that?
Well, I was surprised. I mean, it was very unprompted.
After a brief meeting with the doctor and paying a $150 fee, Taylor walked out with these letters that medically exempt her from wearing a mask or receiving a COVID vaccine, signed by Dr. Elperin.
Did the doctor ever ask you if you had a medical condition that would exempt you from a vaccine?
Nope. There was zero discussion about why I wanted this medical exemption. And, she asked me, "Are you healthy otherwise?" And I explained, yeah.
What would the valid reason be for a vaccine exemption?
I think it's very individual as far as carefully reviewing the past medical history for the patient and discussing with them that based on what their health status currently is.
This is a vaccine exemption form that you signed for Taylor, and you never asked her if she had a medical condition.
I would have no way of knowing any of this based off just a vaccine exemption form. I would have to go back to their chart. I don't have that information stored to memory.
Our October visit confirmed the viewer's tip that Dr. Elperin was signing COVID exemptions for a fee. But before we confronted her, we went back, this time with a hidden camera.
What happened when the doctor came in?
She had the forms in her hand. She just went through them with me, signed them there in front of me, and basically just restated over and over very forcefully that it was a complete violation of HIPAA for them to ask anything about my medical history, vaccinations included, and just filled out the forms right there in front of me.
Did they ask you if you had a medical condition that would exempt you from the vaccine?
They did not.
They charged KENDRA $200, $50 more than Taylor paid a week earlier. With these doctor-signed forms, workers can request exemptions from their employers from COVID vaccine and mask requirements. At Ellensburg's largest employer, Central Washington University, records show 86 vaccine and mask exemptions submitted by students and staff. 20% of them, 1 out of every 5, came from Dr. Elperin.
After she was done signing the paperwork, took it upon herself to restate over and over that she would go to bat on my behalf and she would call my employer if I got any pushback.
We went in a third time, again with a hidden camera.
She came in with a whoosh and she sat down in a chair, had paperwork in hand. She definitely didn't ask me anything about my medical condition or my medical history or any real reason why I would actually need to have an exemption. It was $200 for the visit. It just seems like this is what they do all the time, and it was a regular routine.
Our former investigative producer came out with the same signed forms.
Vaccine exemption, mask exemption.
On each form, Dr. ELPERIN is asserting that the patient has a medical condition. These national experts on medical ethics and law told us there are only two valid reasons for a medical waiver from the COVID vaccine.
Either there has to be a demonstrated allergic reaction to one of the ingredients, or there has to have been a demonstrated adverse reaction to an earlier dose.
To me, it's not a rubber stamp. You know, you don't just come and say, I need an exemption. And as your physician, I say, okay, great, I'll sign that, no problem.
You know, that's the whole reason we give you medical licenses. It's not so that you can become a printing press for exemptions.
I'd like to schedule an appointment to get a COVID vaccine exemption.
For our fourth and final undercover appointment, we flat out asked for a medical exemption.
$200? Okay.
Here, the medical assistant did ask the most important question.
Yeah, I was actually pretty surprised when the medical assistant asked me if I have any medical condition that would make me qualified for this exemption. And I was honest with her. I said no. And she didn't seem to mind.
He paid $200 and walked out with the same signed exemption forms after a brief face-to-face with Dr. ELPERIN.
These are records of 4 people that came in and got medical exemptions with no questions asked.
Once again, just because the person claims to you that they didn't have any questions asked, that doesn't make it such.
You're saying that that didn't happen in those cases?
I have no idea. I told you I would have to go back and carefully review the chart.
That's you signing the documents right there, doctor.
That is me being a physician at work. I have no idea when this picture was taken, and I have no idea what this is referring to.
What you just described is an exemption mill. You hand over money and I ask no questions and give you a piece of paper that satisfies the states that you have an exemption.
Are you running a vaccine exemption mill here?
No.
Where you're taking payments and signing exemptions with no questions asked?
Absolutely not.
So that was the doctor's final word during our on-camera interview. But after that interview, I followed up a couple times with Dr. ELPERIN, and she replied with one email. You are a disgrace to the profession of investigative journalism and to the values of the United States of America. That's what she wrote. Now, vaccines are a divisive issue, I get that, but this is not a story about a doctor's personal views. It's about whether she's being truthful when she signs these vaccine waivers. Joyce, that's what we expect doctors to do, right?
Right. And so what about state regulators? Have they received any complaints about this doctor?
Yeah, quite a few of them, actually. There are 12 complaints on records, most about COVID-related violations. All closed except for 2 open investigations. The State Department of Health is refusing to discuss those cases. We do know that the Department of Labor and Industries inspected and fined her $3,000 in late September for mask violations, but it's clear that she has not changed her conduct at all.
Wow. More to come on this. We'll look for your next report.
Okay, thanks, Joyce.
We have much more on this story on King5.com, including interviews with former employees who claim the doctor made tens of thousands of dollars signing exemptions. Text the word doctor to 206-448-4545. We will send you a link to this investigation.